teenagers who are addicted to the smartphones are more likely to suffer from depression and anxiety. A new study has found. Researchers from Korea University in Seoul found an imbalance in the brain chemistry of young people addicted to the devices and the internet. The study took brain scans of 19 young people diagnosed with smartphone or internet addiction and compared them with those of 19 healthy control participants. Scientists used standardized tests to measure the severity of their addiction and asked the participants how the use of smartphones and the internet affects their daily routines, social life, productivity, sleep and feelings. The participants responded positively to CBT Getty Images. The higher the score, the more severe the addiction, said Dr. Hyung Suk Seo, lead researcher and professor of neuroradiology, also known as CBT. It's a talking therapy that helps patients to manage their problems by changing the way they think and behave. The results showed that addicted teenagers had significantly higher scores in depression, anxiety, insomnia, severity, and impulsivity than the controls. The brain scans showed the levels of gamma-aminobutyric acid GABA, a chemical that slows down brain signals, and glutamine GLX, a chemical that causes brain cells to become more electrically excited, in each participant's brain. This is how the iPhone has changed our lives over the past decade. Having too much GABA in your brain can cause drowsiness and anxiety. The addicted teenagers had much higher levels of GABA and lower levels of GLX than the controls, suggesting these chemicals are strongly linked to smartphone addiction. Researchers found that after having cognitive behavioral therapy, participants' GABA levels decreased and their GLX levels increased. At an education conference in London earlier this year, Harley Street Rehab Clinic specialist Mandy Salagari said that smartphones can be just as addictive for vulnerable teens as alcohol and drugs.